Yes, since you say like those already have a HIM degree and were not able to find the job, I will say try to get certification, because that is the suggestion most of like the professional provide me. At least start with one certification exam that you want to pursue your career in. Like I sit for RHIT, maybe you can sit for RHIA. Also, SIMS provide several certification, or maybe coding certification. Where do you want to start? Based on that, go with the certifications. And also you need to like learn the skills that are used in health IT, like analytics, or trying to see how the EHR or EMR tools work. Because when I started my internship at Compasses Hospice, I was working on the paper record, and I already mentioned that networking with the similar professionals is the best thing you could do with this. And another things that come along with networking is that try to find mentors, and they will help you a lot. I'm still having in mentorship program meeting me with me like on monthly basis or weekly basis, or someone are like just casually giving me suggestion on do this and that also count as mentor, right? So these are the things I will suggest for those who want to get into the health IT field.
The first thing is this was probably easier 10 years ago than it was now. And the reason why is because of meaningful use in the HITECH Act. Converting all the different hospital systems to electronic basically made this a hot field in demand. But now we're mostly implemented EHRs everywhere. So the field is just not as in demand before. So I say that because the moment you say you were interested in something techie, you got a job. That's why. So now it's a little different. If you're interested in getting a job, one of the biggest ones is a EPIC certification. So there's EPIC dominates the academic medical center in terms of market share. So if you're interested in working like an academic medical center, they probably used the EPIC EHR. The EPIC certification is probably one of the most valuable things you can have to be a competitive applicant for the job. That's one. The next thing is if you're already working in a hospital, asking for opportunities to work on certain things, becoming a super user, just basically doing things a little outside of your role that's more in the tech area, either teaching it or even shadowing or helping build some of the tools that you're using. I think that's usually a nice one. And then the other one is just like additional education you can pursue. So formal things like certifications, degree, things like that. And then there's like these maybe like somewhat smaller ones like certificates, CP HIMSS. You have one too, I believe, is like PMP. Like all these certificates are really, really nice. ASHP, which is the American Society for Health System Pharmacists, also has one in pharmacy informatics. So that's something else that you can consider. Tons of different things, no right answer. Many of them are the same. There is probably some differences, but I think a couple of them, I'll list them. The number one thing is probably communication. So in a pharmacy informatics role, you have to be really good at communicating between a clinical audience, like your pharmacist, and a technical audience, like, you know, your IT administrators or your data analysts or engineers, things like that. So communication is really, really important. The second one I would say for pharmacy informatics in particular, I'm a little biased here. I think it's really, really important that you've worked as a pharmacist to some capacity. And the way I think about that is because, you know, if you're building something for pharmacists, it gives you a lot of credibility and you really understand like what is the problem you're trying to solve. I think everyone that has come from some sort of experience or have practiced and then did informatics, that's always really good. And then for data architects, it just kind of depends. If you're designing pharmacy systems as a data architect, that's good. But otherwise, you know, you don't really need the pharmacy experience. And then I think maybe the last thing I'll say for good traits is just like being like, you don't mind sitting down in front of a computer staring at stuff for a very long time. So patient, liking, you know, you enjoy working the nitty gritty of things. Like there's a lot of details. You're very detail oriented. But yeah, I think those are the top three that probably come up to mind.
Yeah, I would say you can be anyone from an introvert to an extrovert as long as you're able to have good communication skills and just communicate your findings effectively. But I don't think you specifically need to be an extrovert unless maybe your goal for like program manager type of role. Then you really have to deal with people more often. So maybe you really do need to have those people skills. But I would say just having good communication, being able to write emails effectively and being a team player, but also being someone that can work individually. Because I find that like the roles in the health IT space, they're very individual roles. You have to be someone that's a self-starter. I would say that is a big part of it. You need to be able to take that initiative to maybe go into Outlook and try to answer a question before you ask your team, which is fine. So ask for help because we're all learning in this space of health IT. Health IT is a growing field, and I don't think the human brain is able to keep up with all the changes that are being made right now. So just having that curiosity and just ability to dive deeper into things, I think that is really going to take you a long way. My tips would be to start with what are you most interested in the health IT space? Are you interested in the health data analytics? Are you more so interested in more so what I'm doing, where I'm a program analyst, so I'm managing a program of data? Or are you interested in something else? So try to narrow that down. And then from there, I would say start looking into you can even look up top health government contractors and companies. I will say specifically go to their career sites and type in like keywords such as like health data or do like clinical documentation. If you have a skill as far as SAS or SQL, typing those in and just seeing what pops up. Because I guarantee you there's going to be a lot. If you have a skill like that, you're good to go. So I would say the best bet in how I'm usually able to find jobs in this field is directly going to those companies that have those type of jobs. And also lots of universities will have health IT jobs. So let's break it down into a free resource and then like a paid resource. So something that they can do for free is they can start learning one of those programming languages that I talked about for a statistical software such as R, such as SAS, such as SATA. And you can learn that for free through resources like Academy, Coursera, and just start building on that foundation which I feel like those are the top skills that will really help you go far in health data analytics. Now, if you want to pay for something and invest in yourself, you can go to coding camp. And I think that would be a great way to really just become very strong in those skills. So I would say I really want to emphasize learning these statistical softwares is going to put you ahead of the game because most people, so if you can build your way up and start learning those skills that most people don't want to learn, that they shy away from those statistical softwares because it can be tough. Honestly, it can be tough. But if you work at it, how are they going to deny you a job? They need someone that knows this stuff. So I think that would be like a great place to start. Yes. And this is something that is super crucial. So I really wanted to talk about it today. So when you're working on your resume, you have to understand that a human is not going to read your resume first. A computer is going to read it, an applicant tracking system. So you have to trigger the applicant tracking system. A problem that I see often across all levels, whether entry level, master's level, experience level, people are making general resumes, which isn't necessarily bad, but it's not good either. And it's not necessarily going to get you what you want. So you really need to tailor your resume and use words, phrases from the job description and put them into your resume. So an example I like to give people all the time is, let's say a job description says they want someone with experience doing clinical documentation and inputting patient information. I want you to say that specifically on your resume, of course, if you have that experience, and word it just like that, just so you can trigger their applicant track. And at the bottom of job descriptions, usually they just have a list of qualifications. Go down that list and add those qualifications to your resume. If you have it, of course, to specifically trigger their applicant tracking system. Because after you do that, then maybe somebody will read it. That's what we want. We want the hiring manager. And of course, sometimes recruiters will read it before a hiring manager, and they may not necessarily be a technical person. They may not know all of this SQL and this and that is, but they'll just see that, oh, they have that. Job description says that. We're going to pass it on to the hiring manager. So it's a very simple thing, but I just want to emphasize it because a lot of people don't do this.
Yeah, so I think you should still apply if you come from an educational background. I've heard a lot of other trainers that came, for example, my primary trainer that was teaching me at that organization, she didn't have any experience in healthcare. She actually came from a school. She was a teacher. I think it was high school. And she just got the job as a primary trainer. So if you're in education, if you're working as a teacher, I think I do recommend for you to still apply for these epic credential trainer jobs because you will still get hired for these jobs. There's no, like the prerequisite of having healthcare experience is not there. As long as you're able to teach something, then you should be fine.
I don't think you really need a specific major. Obviously, it helps. So like I majored in business analytics and marketing, which is very highly tied to what I do now. So I was able to use some of that background to help me. But I will say that with any job, there's a lot of boots on the ground training. And so they're open to helping you work on how the project is best done. If there's any tools that you need to learn how to use, a lot of companies use different tools. So it's never a like one size fits all approach of, oh, I learned this one tool in school and this is the one tool that I'm going to use. So I think it's more about being an active learner, which is actually one of my pieces of advice of being able to have flexibility, wanting to learn new things. And if you say, hey, I really don't have much background in this, but I want to learn, having the flexibility to do that. And then, putting forth any of the other skills that might have came through like your background that you might not have realized. If you were an English major and you did a lot of writing, that comes into play in different areas. So I think that there are transferable skills, even if you don't have, a firm background in exactly what this job is.
This is health IT, and this is everyone else who does something in healthcare. And you can't look at it that way now. Anything you do is tech. So they're not separate. So it's just all health IT is embedded in thinking of technology moving forward. There's so much that's going to need to happen on governance. So because of, got to say the words, the AI, but the technology is developing, evolving so fast, faster than we can regulate it, faster than we can manage it. So getting some advancing governance around data privacy, data security, and segmentation of that data within, like the informatics piece. Having people who understand what's held within and how do we make it more granular and more patient controlled. So having more granular consents, that's a big thing there's a demand, but not a solve for right now. But those are some things I think of, and we're global, even though our healthcare system is unique. Understanding the U.S. health system is ridiculous, but so somebody has to be really good at it. But then in other respects, all of our technology, I'm meeting with someone tomorrow. I was looking at his background tomorrow because it was just like, oh, he's an HIE developer, blah, blah, blah. Oh, he's an HIE developer, but he's working entirely with, oh yeah, there's healthcare in the Middle East. There's healthcare in Egypt. There's healthcare in, what does that mean to exchange or deal with information in a global regard? It's just an exciting world. Like, it's big, very big.
Yes, and we need more people. So for those that are watching and you're on the fence, there's a lot of work. So we definitely need you.
And don't be afraid. So that's the thing, and maybe again, Gen Xer, but I know some of us have mental blocks, and sometimes I do of, that's not me, it's too technical, blah, 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 and don't be afraid of jump in, learn the program, ask questions. Don't be afraid to be part of a technical solution, even if you're not a technical expert, because they need domain knowledge to have successful solutions.
So my program at the time, I thought was a really great program, and it was good as someone starting out as entry level. I started out through a program through the National Health Career Association, and I learned a lot as an entry level biller. But as I evolved in my field, and there were so many things going on, like we were dealing with HIPAA and all the changes that was happening surrounding HIPAA and compliance, I felt that organization was not keeping me informed about the changes, right? And I eventually ended up transitioning into more organizations that I felt was more aligned with my growth, like AHIMA, and then later on in my career, AAPC. And now I'm a part of both. It's important who you get certified through, but it's also important to show up and take ownership of your learning experience. Take ownership of helping yourself to succeed. I was the type of person where I took notes about everything because I was like a sponge. There was so much I didn't know, and I wanted to make sure I understood it. So I was always the type of employee that would take very detailed notes, that would create systems for myself that would help me be successful. So it is partly education. It is partly showing up and setting yourself up to win. And then it's also continuing education, because healthcare is always evolving. And you don't want to think that everything you noted is the way it's going to work tomorrow. So I'm very big on being a lifelong learner and continuous education.